Post-traumatic stress disorder, depression, anxiety, fibromyalgia, traumatic brain injuries, autism, Parkinson's, Alzheimer's disease. What do they all have in common? Well, stress, inflammation, or direct damage that disrupts our brain circuitry and reduces the connections and communications necessary for a healthy brain. When not treated, these damages will worsen, and so will quality of life. My name is Brent Agin. I'm a practicing physician at Prior to You in Clearwater, Florida. I want to provide a brief overview of the program we have created called KETAMIND and how it can help those suffering from certain conditions or feelings that can leave you feeling stuck and hopeless. I have literally spent the entirety of my career exploring the best ways to be mentally and physically healthy, so I can provide this knowledge to my patients, but also myself and the important people around me. Taking this non-traditional approach to medicine means we are forced to do our own research before considering something to be added to our regimens. For that reason, I spent over 10 years studying ketamine. Initially, my sole focus was to help those suffering from any form of mental illness, but what I discovered was ketamine has way more therapeutic opportunities than initially considered. My vast research into ketamine started with analyzing results and information from the initial medical experts using ketamine. But it was through my own experiences and the impressive results, both short and long term, I observed with my own clients, which led me to the creation of the KETAMIND experience. I want to first start with a little background on ketamine. Ketamine was approved by the FDA as an anesthetic in 1972 and quickly was recognized for its excellent safety profile. So in 1985, the World Health Organization added ketamine to the essential medicine list. Ketamine is the preferred anesthetic in many cases for children, people in hospice, emergency rooms, and both the military and first responders. In the 1990s, ketamine was already being researched in the military for PTSD. And today, ketamine therapy is now an instrumental treatment for our military veterans for PTSD and other forms of combat-related traumas. The results with the military is what initiated the expanded use of ketamine and helped doctors like myself see more closely why it was successful for mental illness and, more importantly, how it could be applied to other areas of medicine. With impressive data continuing to surface, in 2019 the FDA approved Spravato, the first ketamine-based pharmaceutical for the treatment of depression, which has led to the tremendous interest and expansion of ketamine-related therapies. The simplest way to explain why ketamine has such a high success rate is because of the way our body and brains respond to stress. Stress, when severe or chronic, leads to inflammation and damage to our nerve pathways, and without a doubt is hugely responsible for this continual rise in all areas of mental illness. You see, our brains have a very complex communication system that even the smallest change can disrupt or damage the signaling system in our brains that eventually will cause symptoms and disease. Over time, these inflammatory changes, if not corrected, will cause people to be more tired, less motivated, moody, and most importantly, unhappy. And people can get stuck in this situation for years. Understandably, at this point, many are already deep in a vicious cycle of slow and progressive negative changes in their life that are likely already impacting their life and the lives of the people around them. At this point, frustration, anger, sadness leads to the feeling of desperation and hopelessness that wither away at a healthy living, personal interactions, and decision making that can literally cause people to spiral out of control. It is at this point that ketamine comes in. Traditional therapies such as pharmaceuticals and counseling have limited success rates and can take weeks to months before knowing if they are even helping, time that people in this state just don't have. Ketamine infusion therapy can positively influence these damaged or poorly functioning nerve pathways within a couple of hours and quickly provide just enough hope for people to break the cycle, feel empowered, and start to get onto a new journey focused on getting their lives back. Ketamine can quickly balance certain neurotransmitters that help us respond to stress, while also increasing the concentration of a protein called brain-derived neurotrophic factor, or BDNF. It's these changes that are responsible for repair, growth, and reorganization of our nervous system back towards an initial healthy state. This journey for many can seem daunting, But when you can get a little hope and your brain is sending the right signals, it can be just the motivation needed to get back on track and see the light at the end of the tunnel. Remember, there is no magic pill. So for ketamine therapy to be successful, it requires aggressive changes in daily activities, most importantly, a healthy lifestyle, which is essential to optimal brain health. The combination of ketamine, along with improvements in sleep, diet, and exercise, will create the energy and the confidence needed to get moving in the right direction. The mechanism of action of ketamine on our brains makes this therapy an option for those suffering other causes of brain dysfunction, such as post-concussive syndrome and traumatic brain injuries. It is pretty obvious that ketamine can be helpful for many different situations, and is not just for those with severe mental illness, but for anyone that is struggling in life and just cannot seem to find a way out. I believe we are all our own best counselors, but we never get that opportunity to just push pause on our current life and all the daily stressors that we face so we can reflect, process, and grow so that we can forget the past and focus on what we control, present time, and our futures. Remember, happiness is not given. It is your creation and completely controlled by your decisions and actions. That means we are all capable of happiness, but sometimes the brain just needs to be reset and rejuvenated to kickstart your journey to a happier you. The KETAMIND experience uses a combination of ketamine infusions and bioharmonic technology to create a relaxed audio and visual therapy session with uninterrupted time for yourself to self-explore, self-counsel, and create a new perspective on life and appreciation for our most valuable resource, time. When people can reach this state, it can be life-changing. If you can identify with any of these situations, ketamine might be just what you need. Call our office so we can have a consultation and start talking about your ketamine experience.